Okay, good morning. My name is Lydia Morin, and I'm the Executive Director of Connect, and I'm so excited to welcome you to Connect's Pre-Arrest Diversion Summit. Before we get started, please turn your cameras off. This will help make the presentations clearer since there are so many of us this morning. And thank yous all for Zooming with us today. Also, please click the three dots next to your name and click Rename to add your name, affiliation, and pronouns. For your affiliation, you can write person with lived experience, your organization, your community, etc. As you can see from the poll, we have a lot of different types of people here. Throughout the day, we will use polls like this one. And if you haven't done it yet, please do. Shared on your screen and in the chat are our summit meeting norms. If you have any issues or concerns during the summit, please message Connect staff member Kaylee Dryden. Thank you, Kaylee, for all the incredible work you did bringing this summit together and the whole Connect LEAD committee, especially our lead director, Joellen Marsh, and community engagement and Turtle Creek Mayor, Kelly Kelly. Connect brings together the city of Pittsburgh and 40 surrounding municipalities to identify, research, and address common public policy and programmatic challenges. We were founded by Dr. David Miller in Pitt's Graduate School of Public and International Affairs, and we are so fortunate to now be advised by our new dean, Carissa Slaughterback. However, none of this happens without the collective leadership of all of our member municipalities. Together, we advocate for collective change, and this regional convening is another way we can honor the legacy of Dave, who we lost in November. For more than a decade, our member representatives and partners have been working together to seek solutions to major public health and safety concerns, including accidental opioid poisoning and mental health crises. These challenges have touched all of us, and in spite of our best efforts, the Allegheny County Medical Examiner released a report last week stating that overdose deaths have increased by 22% in 2020. In 2019, to build on our success working with the Allegheny County Health Department in reducing opioids-related harm in all of our hometowns, Connect members passed a resolution to pursue law enforcement assisted diversion, or LEAD, as a major national strategy to address these shared challenges. Arresting people has been our only tool for a long time. And to quote one of our bravest and longest member representatives, Mary Ellen Ramage from Aetna, who stood up at one of our first Connect events for LEAD and said, "We did this. We, as elected and appointed officials, put it on our police officers to arrest our way out of a problem, and we can't put it all on them. We must make systemic changes." We are here today because we agree that we need more tools that will address mental health, poverty, homelessness, systemic inequalities, and other root causes that encourage so many of us to engage in criminalized behaviors or substances to cope with our trauma. Today's speakers will talk about our systems and barriers, how we got here, and how adopting pre-arrest diversion alongside other innovative strategies can help us move forward. We hope you'll join us again at the same time next week as we come together to work on next steps for pre-arrest diversion. Before we start our keynote, we will hear brief remarks from 4 of our county's elected officials. A huge thank you to Allegheny County Executive Rich Fitzgerald for supporting us all along the way and for being here today to kick us off.
Well, thank you, Lydia, and thanks to everybody who's participating in this. You know, the one thing that I think we do well in this region is when we bring problem solvers and people who meet challenges to the table, even a virtual table, to come together and work together on meeting, you know, common issues and common problems, like I said, challenges. This couldn't be done without the type of leadership we've had, and I want to thank Judge Clark. You know, she has just been a real champion in doing some real major reforms that have been recommended by the Institute of Politics and other organizations that can improve the criminal justice system, reduce jail population, improve people's lives. And that's what Connect is all about, bringing people together. As you mentioned, you know, the city with Mayor Peduto's leadership, meeting with all over 40 other municipalities that are connected to this region and connected to the city, you know, all working together. And these are the type of things that we have to do. So as we can learn about how to divert people and not put everybody in jail who comes in contact with law enforcement, the people that do have substance abuse issues, have mental health issues, drug and alcohol, et cetera, and ways in which we know if they are diverted, it's a savings to the taxpayer, it's a savings to these individuals, the recidivism rate improves, et cetera. There's just so many benefits of all that can be done. So I want to thank Chair DeMarco, who I've worked with for years on many issues for her advocacy. And again, the partnership that comes together with the jail, the public defender's office, the DA's office, the courts, all of us working together, our health department, DHS. This is one of those things nobody can solve by ourselves, but all working together, we can make some real systemic change and great improvements. Thanks, Lydia. It's good to be with you.
Thank you so much, County Executive, for your leadership on these issues, and so pleased to introduce President Judge Kim Berkeley Clark. She currently serves as President Judge of Allegheny County. She has worked diligently on improving our county's juvenile justice system, and she is undertaking efforts to reduce overdose deaths among court-involved populations.
Good morning. Thank you, Lydia. I'm so pleased to be here and pleased to always share the screen with County Executive Fitzgerald. Everyone who knows me knows that one of my mantra is collaboration rocks. And I can say that I think Allegheny County does that in a big way. I'm very pleased to work closely with County Executive Fitzgerald and his most excellent staff and many of you that are participating in this summit today. So I just want to state that the Court of Common Pleas in Allegheny County is committed to diversion. I think we've done a pretty good job on the juvenile justice side in using diversion at every stage, pre-arrest, post-arrest, diversion, but we need to do more, and we really need to tackle the criminal justice side. The United States arrests, charges, and incarcerates more people than any other nation. We have approximately 2.2 million people living in local, state, and federal institutions. The outcomes are not good. Disproportionately, people of color and people living in poverty are affected by arrest and incarceration. And even just an arrest can be life altering. I see it all the time. I call it the trickle down effect. Many people who are arrested, even for short periods of time, that end up in a jail, lose their livelihood, they lose their homes, and they lose their children. I've seen it. And when that happens, they lose hope as well. And so I really think that we need to work on diversion in a big way, in many ways. And so our court has worked hard on the juvenile justice side. We have partnered with many of the folks that are in this meeting today. We are now looking at working on the criminal justice side in a bigger way. And so we're highlighting diversion for those people with opioid dependence so that they can get treatment that they need and not jail and incarceration and not records, which has a lifelong effect. So I believe that people can change. I have seen it every day, and we don't need to arrest them and we don't need to incarcerate them to make this happen. The power of redemption is so huge and so wonderful. And I am just excited that we're all here together to talk about these important issues and to develop a plan in Allegheny County. Thank you so much.
Thank you so much, Judge Clark, for your leadership and for your action and for your words. That was also powerful, and it's only getting more so. Now I'd like to introduce Mayor Bill Peduto, Mayor of Pittsburgh.
Hi, I'm Bill Peduto, the mayor of the city of Pittsburgh. Lydia, thank you for the introduction and for your leadership. And thank you to Joe Ellen, Kelly, Allegheny Health Department, and the organizing committee for convening local experts and national experts as well. But I have to take a moment before I begin any comments to thank Dr. David Miller, a personal friend of mine and a mentor, who not only had a vision of how we could work together, but how we could work together for the betterment of all of our residents. The city of Pittsburgh and the neighborhoods and communities that are connected to it was his way of understanding that we're all in this battle together, and that by working together we can solve longstanding problems. And probably right now there are no other stronger issues that we face in our communities than helping those who are suffering with mental health, substance abuse, and find themselves because of poverty in a situation in which they're homeless. We've been proud to work with Connect in order to create diversion instead of sentencing as a means to being able to help those in need. And we've been very proud to work with Connect and Allegheny Health Networks and others in being able to create an Office of Community Health Services, a way of being able to recognize that not every problem is a criminal offense, and that our neighbors who are struggling with substance abuse, those that are living with mental health issues, and those that find themselves homeless are not breaking any criminal code and should be treated with the ability to help them to help themselves. This is a very important issue locally. Pittsburgh is proud to have taken a lead and have worked with our neighbors in other surrounding communities to address an old problem with new solutions. And we're lucky that we had a leader like David Miller who helped to create an organization like Connect in order for us to be able to succeed.
Thank you, Mayor Peduto, for your leadership. Now I'm honored to introduce Connect's chair, Dr. Patty DeMarco.
Welcome to the Connect Pre-Arrest Diversion Summit. It's my great joy to share with you one of the great success stories of Connect as a way of pulling together a problem raised by small municipalities regarding concern for providing appropriate and preventative care in our communities. It came out of our initiative to look at what issues are dealing with in our communities in response to opioid crisis, in response to stress over COVID, and all kinds of other emotional distressors in our communities. This program offers a way to have an alternative to police action for people who are in need. And it came from our human resources and public safety working group, public health and public safety working group, and was underwritten initially by a grant from the from the Stoughton Foundation, which funded the pre-planning research headed by Joellen Marsh, our project manager. And there has been a great deal of interactive development with the communities to identify what the needs are, what the concerns are, and what we might do that would enhance the capabilities in small communities as well. So we have put together a program in collaboration with the Allegheny County Health Department, which has funded the current effort, and have done outreach and developed a resolution at our 2020 Connect Congress. And 11 communities have now adopted that resolution and are in motion, including my own community of Forest Hills. And I want to share with you the comment of our mayor as he is implementing this program as one of the early implementers. He says, Mayor Frank Porco, this program is designed to offer an alternative option for low-level offenders, either through social services or public health intervention as compared to jail time. This program will ensure the more vulnerable members of our community are directed to the appropriate channels to get them the assistance they need, whether it be mental health assistance, counseling, or rehabilitation. The main thing that we will gain from this law enforcement assisted diversion program is to break the cycle of people of non-violent minor offenses ending up with a penal record and having impediments for the whole rest of their life from a result of an arrest. If there are things that we can do to help people in constructive ways, other than having them arrested, it does make better use of our police services, and it does make better use of our community concern and community care. I think this is one of the ways that Connect helps communities to improve the quality of life for all of us by working together. And I'm so delighted that you're all here to share what we've learned and to bring your own experiences to this process. Thank you for being here. Talk to you soon.
Thank you so much, Dr. DeMarco, and thank you to all of our elected officials for your remarks, your leadership, and your innovation. The entire Connect team sends a huge thank you also to our Summit Planning Committee, our Connect members and partners, to all of our awesome presenters, to the LEAD National Support Bureau and Two Hats for marketing support, to the Graduate School of Public and International Affairs at the University of Pittsburgh. And the funding for the summit comes from the CDC through the Allegheny County Health Department. A couple of quick reminders before we get started. Please use the chat to ask questions and connect with each other and with the summit organizers. Although some of the presentations are pre-recorded, each regular session has a live Q&A with the speakers, and we hope a lot of positive interactions. Planning Committee member Jess Williams will be collecting questions for the Q&A, so please feel free to message her with specific questions. Lastly, some of these topics are sensitive, so we are providing a virtual hallway for you to access at any time if you would like non-judgmental support or just someone to talk to or vent. To join it, click breakout rooms at the bottom of your screen. This breakout room will be staffed by Planning Committee members Don Lehman to provide support. One thing I've learned from Connect's network is that real policy change can flourish only when we build trust and meaningful connections with each other. And, related to the opioids crisis, when anyone feels excluded for any reason, it lights up the part of the brain that feels pain in a major way. Studies have shown that exclusion causes the same pain in our bodies that physical pain does. So policy change must be inclusive. And I think part of the why LEAD resonates so much with our network is that it applies these same foundational principles to supporting positive change on an individual level. To quote one of our favorite Pittsburgh celebrities, Fred Rogers, "There's a world of difference between insisting on someone's doing something and establishing an atmosphere in which that person can grow into wanting to do it." And that's what we're all here. Let's grow together. We're thrilled to hear from our opening keynote, Kurt August, the Deputy Director of Diversion and Deflection in the City of Philadelphia's Managing Director's Office of Criminal Justice. He will present on the work Philadelphia has done to implement a pre-arrest diversion program. To view his full bio, click the link in that chat. He will be joined by Philadelphia Police Officer Valerie Felici, who is detailed to this program and will share about her experiences. Welcome, Kurt.
Thank you so much for that introduction. It's an honor to be here to speak with you all today. I know that we have a limited window before we transition over to the next panel. And the genesis of really my appearance here, I think, has to do with the fact that the city of Philadelphia is fortunate enough to host a delegation from Allegheny County when this was in sort of the early contemplation, sort of pre-planning stages for this work. So to see it come full circle to where you all are in a position to launch your own version of this, is certainly very, very encouraging for the future possibilities of the model, the collaborative work we're trying to do across the state of Pennsylvania to improve the quality of life of some of our most vulnerable residents. And I really want to congratulate everyone who I'm sure put in countless hours to make a moment like this possible. So really want to lay the context for folks that are aware. Obviously, I'm coming to you from the city of Philadelphia, where we are in the midst of dealing with sort of overlapping public health crises with the COVID-19 epidemic, surging gun violence epidemic, and the opioid crisis, all of that overlapping with the fact that for several years running, we are sort of the largest urban center with the highest concentration of deep poverty in the country. It's a long-standing social problem, and the work of pre-arrest diversion is one of the tools that we're using to try and mitigate some of the negative impacts of all of these kind of concurrent social issues that we're trying to address. We got started with this in late 2017, early 2018. And one of the cases for it is really has to do with the opioid crisis in the city of Philadelphia. You know, we've had a consistent sort of surge of both fatal and non-fatal overdoses. The highlighted areas you see are the pilot zone for our pre-arrest diversion initiative. As folks who have been to the city may be aware, a lot of that's in the epicenter of Kensington and North Philadelphia, and areas where there's been a high concentration of people with unmet health needs, many of whom have suffered from both fatal and non-fatal overdoses. So we used the data around that as a guide for where the pilot zone of this work should start, but also the sheer volume of the numbers across the city and in these concentrated areas were large contributors for why there was such a sense of urgency of getting this off the ground. And I know some of the speakers that came before were also highlighting, you know, the rise in fatal and non-fatal overdoses in Allegheny County, and how that's really an impetus for why this work needs to get off the ground as soon as possible, so that it can really bring those kind of early intervention benefits to folks. And it's the same thing with fatal overdoses, with people who were dying, you know, in concentrated areas. And we wanted to make sure that police contact in those neighborhoods, you know, was set up with a set of circumstances where it could transition quickly into health services in real time, to give people the best possible opportunity to get their lives turned around and get their unmet health needs addressed. Another part of it has to do with you know, local jail population reduction, right? So at the very start of our work, you know, we had a local jail population that was over 8,000 people. You know, we felt that that was a very high number. It was incredibly burdensome, you know, on the local jail system, and city taxpayer resources that come out of it. And frankly, to tell you, you know, I don't know exactly the calculation in Allegheny County, but in the city of Philadelphia, city taxpayer dollars you would save city taxpayer dollars by sending by paying for a year of tuition, room, board, and meals at a local university. You would spend less taxpayer money on that than you would to have someone with acute health needs spending a year in our local jails. You know, and with a little extra grant money, you know, which I'm sure they would qualify for, we could even get them into the Ivy Leagues and Penn and places like that. So just for a contrast of just kind of where your taxpayer dollars are going, you know, I think that that's something that's really important to highlight, you know, that the cost, and again, we're talking about trying to proactively address, you know, people's complex unmet health needs. And the cost of housing someone in your local jail system with acute health needs is extraordinary. And frankly, there's a lot better ways that we can be helping people in those kind of situations. And that was a major driver for, again, why we felt the sense of urgency late 2017, early 2018, to get our model of pre-arrest diversion off the ground, you know, as a way to reduce unnecessary and potentially lengthy stays in the local jail system for people that are brought in for low-level drug charges, retail thefts, you know, and low-level prostitution cases as well. We've seen a dramatic reduction that's taken place. And again, the pre-arrest diversion work is not the sole driver of that, but it is a contributing factor. And again, reducing the local jail population, having some real-time service connections available to try and mitigate the disastrous effects of the opioid crisis were really two of the major drivers for why we got this off the ground in Philadelphia when we did. In short, like our police assisted diversion work, pre-arrest diversion, in a nutshell, is frankly, it's the earliest possible opportunity for behavioral health interventions in the criminal justice system. And that's the point of contact with police, right? So before anything else happens, someone is contacted by a law enforcement official. Pre-arrest diversion is not trying to be a substitute for law enforcement interaction. You know, I think there's a legitimate justification that we want police to intervene, you know, around problematic behaviors in the community that are impacting other residents. You know, even things like open air drug use, purchasing drugs on the street, you know, low level retail thefts, things of that nature are all there. I think what we're trying to push for pre-arrest diversion and the merits of that are, what do we do after that? You know, is the community more benefited by processing people through the traditional pathways of the criminal justice system? Or after that police intervention, are we going to be able to try and set up a collaborative effort to address that person's health needs in real time? And just sort of what's a better investment of our time, money, and resources that are connected to that? You know, so that old saying goes, the best time to plant a tree was 10 years ago, and the next best time is today, right? So, you know, early intervention is key. And frankly, the realities of the public health crises that we're dealing with locally, nationally, globally, I really think is an impetus for why we need early intervention opportunities at every possible step in the justice system. And pre-arrest diversion is simply leveraging the point of contact with police at low-level nonviolent offenses to try and transition that opportunity to create a motivational moment to get somebody connected to health needs in real time. So the traditional pathways are really the arrest diversion work, which I think is the highlight of what we're doing here in the summit. So someone is taken into custody, there's a police intervention, they're placed under arrest, and then again, it's what happens now. So instead of the traditional pathway, that arrest is going to lead to an opportunity to get connected to health services. The LEAD model also has a social referral component, and those are frankly just police-initiated warm handoffs to service providers in real time, where there's no reasonable suspicion or probable cause for an arrest. So what the police would consider to be mere encounters, right? So before, the traditional model was you were encountered by the police and they either took you into custody or left you in the exact same situation they found you in. So the work of the LEAD model, the social referral process, is really just establishing an intimate partnership between behavioral health providers and law enforcement, so that when police are encountering somebody, even if they don't have sort of the preconditions to initiate a stop and make an arrest, they're still able to engage a person with complex unmet health needs and offer a warm handoff to somebody that can invest the time and resources to try and help that person in real time. And there's also kind of a corresponding component to it as well, where sometimes it's not a warm handoff, it's a tandem response, right? You pair police and behavioral health professionals together to engage in hotspot locations. In the city of Philadelphia, we have them responding to quality of life related kind of calls for service in real time. In the winter, for instance, calls may come in about people that are residing in an abandoned home. So we want to send police with behavioral health together in real time to make sure that engagement is going to lead to, is going to have every opportunity to lead to a health-centered resolution for folks. And another thing to highlight about the work of diversion programs is they're inherently collaborative. The only way that this can work is through regular communication, flow of information, and like constant collaboration between some major city agencies and local entities as well. So the mayor's office is usually kind of the driver, the glue that puts these things together, the people that find the money for this work. Obviously, you have the police department, your single county authority. For us, it's the Department of Behavioral Health and Intellectual Disability Services, the district attorney's office, your local public defenders, your court system, probation officers, local social service providers, and community residents all have to come together. And this is really an ambitious project that cities and local townships have been trying to figure out the secret sauce for quite some time. But this world of transitioning people from the point of arrest to getting connected to help is sort of by definition, because people are going to have prior entanglements. They might have some level of community supervision. They might already be linked up in the behavioral health system. It sort of creates the conditions that sort of naturally pushes all of these entities to figure out ways to collaborate, to come to work group meetings together, to collectively problem solve situations, discuss complex cases, and all of those things are sort of that collaborative element I think has been elusive in a lot of ways. And this pre-arrest diversion work really creates sort of a natural opportunity for that to happen and really to grow and refine itself over time. And it can certainly be applicable in other areas of city government as well when you try and figure out how to get sort of interagency kind of collaboration and flow of information. This pre-arrest diversion work I think is really critical with that as well. This is briefly just a summary of some of the work that's really through 2020. I'm willing to share with Laura and Joellen and folks some of our 2021 data as it comes across. I think one of the things that we want to highlight here, instead of just sort of reading through the numbers, I'm under the impression the slides will be made available to everyone, is confirming that the demographics of the people that are receiving the opportunity to get diverted at the point of arrest, that are being, having warm handoffs through police engagement to health service providers, that the demographics of that population kind of mirrors the demographics of the neighborhoods where this work is taking place. So collecting that information and reconciling that on a regular basis and making sure that that's consistent, I think is a way to ensure kind of the accountability, equity of the approach that's taking place. But again, just kind of making sure that the work is touching the people that are in the most need of those services in the area where you're going. When we say engagement, we really mean people that are making follow-up appointments after that first sort of point of contact with the police and are engaging with, for us, it's sort of peer support and case management services that are done beyond sort of that basic stabilization around the means of survival. That first encounter you're going to have at the point of contact from the police, if the person doesn't have sort of imminent health needs where perhaps they need a level of care assessment and transition into short-term detox, short or long-term inpatient settings, and transition to recovery house, a lot of folks are really going to need as a first step just to have their basic needs addressed. So engagement for us is just the degree of folks that are consistently following up, that we have good contact information with, that we're seeing on a regular basis. And one of the things that we should highlight, is the fact that it's not universal, right? Like, it's not 100%. That shouldn't be a goal of anybody's work, to have sort of perfect compliance with this. Pre-arrest diversion is not a magic pill that's going to address every deficit that might exist in your behavioral health system, in your homeless service system, or anything of those nature. People are still going to run into barriers. People are still going to fall off the wagon. They're still going to have struggles, but it increases the likelihood, and it connects folks to community-based supports in real time, so that when they do want to re-engage, when they need someone to talk to, all that's going to be set up for them. And that really started with, again, having a point of contact with a law enforcement official. And again, our rearrest rates, which we use as kind of a substitute for recidivism, because that's, in the criminal justice world, a bit of a loaded word in terms of what exactly that means and what constitutes recidivism, whether it's arrest, whether it's conviction, things of that nature. So we really say for folks that have been arrested a second time, and depending on where you are in the country, that number may be high or low, but I can tell you in the city of Philadelphia, that's considered a very low number, and lower than sort of the traditional pathway of processing people for these low-level charges, running them through the system, giving them fines, fees, community-based supervision, potentially a period of incarceration, and sort of the collateral consequences that run with that. People's likelihood to reoffend in the city of Philadelphia is much greater than when we're able to divert them into health services, give them an opportunity to get their health needs addressed in real time, and connect them with community-based supports. So I want to talk a little bit about benefits that are connected to the work. Some of the issues that we've run into, and then I'm going to leave the rest of the time for Officer Felici, who again is a colleague and collaborative partner in the police department that is actively involved in this work on a daily basis. And I want her to be able to share her perspective with all of you as well, as somebody that's doing this work, as a sworn officer in the field, and give her an opportunity to kind of convey the pros and cons from her perspective. But one of the major things is processing time, right? So when you divert somebody, you are by definition kind of reducing the amount of paperwork on the police end that's connected to this. So that's an effort for community-based policing as well. So if the goal is to have, a consistent uniform presence in areas where you're trying to combat gun violence and do other things of that nature, you don't want, police officers spending 90 minutes, 2+ hours kind of doing the paperwork and booking somebody, putting together the charging paperwork, things of that nature, for, some low-level drug case, where somebody, had $20 to $30, worth of product, or some low-level retail theft or prostitution case, things of that nature. Like, those situations can be bogged down. And again, they take police officers off the street doing paperwork when they could be a uniform presence in the community to address some of the bigger, more complex needs. So that work is really critical. There's also like reduced case processing time, right? So When you want to file the charging paperwork and do everything else that's connected to that, that takes, a detective, another person in the law enforcement community that has to spend time processing these jobs, right? If the person is going to be arraigned, that requires somebody to get on the docket list. There's court staff that are involved in that. The district attorney, the public offender, all have to assign staff to do that work. All of that costs time and money, contributes to a backlog of low-level cases that have other negative effects on the entire system at large. If you divert drug cases, every time you do that, you are setting up a situation where, for us, we're not logging that as evidence, right? We're classifying it as investigative objects. So by definition, we're just simply not sending that off to the lab to get tested, which is another thing that creates significant backlogs in the system. It's a high cost to city taxpayer dollars. To send every narcotics, every piece of narcotics that you recover off to the lab to be tested and confirmed and, logged as evidence and stored. And all those things really kind of, again, contribute to a lot of other issues that are connected with it. There's reduced transportation time too, when you're making that kind of quick handoff to a service provider, whether it's at the local district or in that community-based setting. Again, it's a quick transition where, again, you're not bring somebody into your local cell room, so you might call it. And frankly, like we said in the beginning, you're reducing your local jail admissions, reducing the likelihood that people with complex unmet health needs, with substance use disorders, with co-occurring mental health issues, with people that are struggling to cope with the conditions of living in extreme poverty. The system is not well served by bringing these people into the local jail system. It's incredibly costly to taxpayers and frankly has limited benefits to help the person actually get connected to what they need in real time. And then there's really the benefits of the early service interventions. You want to create, off ramps of the justice system. Really the importance of early interventions, connecting to peer support and all those kind of things. But it's really also embracing the reality of what's going on from a public health perspective. So we're talking about the opioid crisis, right? So connected to that is also the unprecedented toxicity of the local and national drug supply, right? So when we're talking about opioids, we're talking about the derivatives that are connected to it as well. Most people are aware of fentanyl. I assure you there are many other derivatives of fentanyl, that are based off of that. Things like xylazine that are used, in veterinary settings and things of that nature are also active out there. But the more that proliferates, it's an unprecedented level of toxicity that creates a real sense of urgency. So, in the late 90s, early 2000s, sort of the regular kind of pure heroin users, typically, would be able to use and have some level of stability for a couple hours. We're seeing with the proliferation of synthetic opioids that people are going into painful withdrawal settings in 60 to 90 minutes. So the reality is that there's a very limited window when somebody's going to be amenable to accepting help, where they're really going to be seeking it, and you're going to be able to try and get them connected to help, believe that help is possible, get them connected to appropriate services before withdrawal sets in and the pain becomes so great that the level of desperation to kind of go out, and get well again is going to become overwhelming for a lot of folks. So pre-arrest diversion is really the most reasonable way to go from that point of contact with police, which again, you'd be surprised, right, that it really has an alarming effect to kind of reset people's expectations. When people are stopped by the police, they really think that something else is about to happen to them. So when you talk to them about the possibility of transitioning from this to consultation with a health provider and somebody that might be able to get you connected to treatment or kind of help you figure out where your next meal is going to come from, that can really create a motivational moment for someone. And again, in the reality and the conditions that we're facing today, that window is kind of shrinking by the minute. So the ability to quickly transition someone from the point of contact to police to behavioral health providers that can get someone the appropriate medication and health services that they need is going to significantly increase the likelihood that people are going to be able to transition from the situation where they were contacted by the police to getting connected to more kind of stable supports in the community. This work also, frankly, promotes racial equity, in a lot of ways. So again, folks that are members of communities that may have had a history of being, overly policed. They often are going to come up with criminal records, histories that have often traditionally been a barrier to entry into other services, into other sort of alternatives to prosecution and things of that nature that exist in real time. So there's that. And then from a public health perspective, from the city of Philadelphia and what we've seen across the state and nationally too, is that not only are we seeing an increase in overdose fatalities, but we're seeing a specific significant percentage increase of both fatal and non-fatal overdoses, and connected to communities of color. So bringing pre-arrest diversion work into this, when we're seeing a surge, in overdose fatalities for communities of color, because again, we're seeing fentanyl getting mixed in with cocaine, with methamphetamines, with other narcotics that it's also being, mixed into. People have no idea what they're getting involved in a lot of times when they're taking some of these substances, and we're seeing some really dramatic, negative health impacts that are coming from that. So bringing pre-arrest diversion is also something that is sort of an urgent response to the reality of that situation as well. So again, the police are able to divert folks, that might have had, a history of contact with the police, and able to get them addressed to their health needs in real time. That's really creating a real benefit, kind of resetting expectations of what those encounters can be like for folks. But again, it's also, responsive to the sense of urgency of what the reality of the public health data tells us, to address kind of racial equity issues from that sense, and kind of access to care, right? Because most of the people that we're encountering through this are not sort of traditionally folks that, are seeing their primary care provider on a regular basis, having kind of annual dentist appointments and connected to kind of stable like services, so you're getting a unique opportunity to try and work to connect people to health services that have not availed themselves of it, but are in desperate need of it for quite some time. And every time you can do that, again, it can generate tremendous savings. Even a slight reduction in the high frequency utilizer population of people that are accessing, the emergency room and the shelter system and everything like that, a very slight reduction in that can generate enormous cost savings, at both the local, state, and federal level. So it creates really a unique opportunity for that. Concerns are situations that involve, collaboration with the courts. Some folks are going to come up with low-level warrants, prior FTAs, that are connected to again, people that are in the throes of a substance use disorder. They have difficulty making court appearances at times. The concept of like, showing up, next Wednesday at 9 a.m. at this address. People have, unreliable, shelter situations, phone access, transportation access, things of that nature. So, some people are not going to be eligible because they're going to have active arrest warrants, on the case. So a lot of times they're going to end up being processed with that. And I think that's something that still needs to be addressed. There's a sustainable funding component. A lot of the pilot work starts with grant money, from the state, the federal level, from foundations, things of that nature, transitioning from grants to city taxpayer dollars, transitioning, some of the contracts for behavioral health providers to the highest degree possible, but things can be billed for Medicaid and things of that nature. They're all complex, elaborate processes that take a lot of time to scale up, and the work, in order to make the work sustainable, there's a lot that needs to go into that. There's also a consistency issue. When you start a pilot with work, you create a pilot zone. Outside of the pilot zone, which is in some cases literally going to be across the street, there's kind of a differential intervention with that, right? So, if you're diverting low-level drug cases in this particular neighborhood, but the next neighborhood over, you're not, you're going to create some issues about a kind of equity, fairness, and the ability to, again, scale it, make it a citywide program that's offered 24/7 is a tremendous challenge. And frankly, the city of Philadelphia, we're not there yet. And we get community feedback, around sort of the fundamental unfairness that's connected to that. So we're trying to find a way to scale this as rapidly as possible and do it sustainably as well. And again, the more you're going to try and integrate this work into everyday policing, the more it needs to become into CIT training, part of the police academy, and everything that comes with that. And then again, you need that kind of consistent, communication with the community, getting regular feedback from them, making sure that the model is responsive to the unique needs of the neighborhoods that you serve, that the service providers are adaptable to kind of the changing conditions of what people's needs are every day, and that trust between police and behavioral health is something that requires maintenance, that you have to work on and kind of reinforce every day. So there's really kind of a cultural component too of trying to make shifts between both entities that have worked together in some ways, but usually kind of separate and independently. And this involves much more of an intimate collaboration, and that's something that I think requires a fair bit of attention as well. And now I'll ask Officer Felici to unmute herself. She again has been detailed to the program for the last 18 months or so. She's got over 15 years of experience in the field, and I hope she's okay with me putting this out there, but she does run her own independent nonprofit on her own time. So when she's not on duty as a police officer, she is actually spending her own time out there trying to help people get connected to appropriate services. So she's been incredibly dedicated to this work, working with this population for a number of years, and has really made a tremendous difference for us in the city of Philadelphia. We're honored to have her as a partner in this work, and we'll ask her to unmute herself and speak briefly about her experiences as a Philadelphia police officer with this model. So thank you again, Officer Felici.
Thanks, Kurt. Hi, everybody. Thanks for having me. I'm Officer Felici from Philadelphia Police Department. I have 20 years experience on the job, been doing this for a long time. I want to say great job to all of you from Allegheny County that are willing to step up and be a part of the solutions, because it takes a lot for, any type of government to step up and do the right thing. That change is needed. So I thank you. I thank you a lot. I also want to say, I lost my son to an overdose 2 years ago as a part of this epidemic. And I've been, like Kurt said, running my own nonprofit and been advocating for those dealing with substance use disorder, homelessness, mental health issues for over 10 years now. So this is very important to my heart. And I have to say, I was a little skeptical when this started, how this was going to go and what the buy-in was going to be from the city and from police officers, because as police officers, we're so used to doing things one way. Is totally taking that and spending my career. I feel like I make a difference. I think the officers that you have running your program are going to be a big part of the key to the success of your program. It's very important to have officers that are very well educated and know how to handle things without judgment and know what they're saying when they're talking to someone who has these issues. Substance use disorder, mental health is a very serious thing here, as well as where you guys are. These are a very large county dealing with a lot of the same issues. So as a police officer, I have to tell you that I feel like this program is making such a big difference. And I really wish you guys the best, because you're going to see, I can tell you real quick top of my head, from January to May, we have already helped 705, I believe were the numbers when I looked. And, listen, not everybody may be willing to have in that moment take that help, because it really catches people off guard that police are here offering this help with no strings attached. So, but they know that the program is there, and we do have people coming back in after the fact and saying, hey, were you serious? I really want that help. So you're going to say, and when helping one person, remember, the one most important thing is you're not helping just that one person. You're helping their mother, their father, their brother, their sister. And it takes a community to truly help a community heal. So understand that when you're helping that one person, you're actually helping an entire family, and helping family after family after family is what's helping communities heal on all different levels. So I congratulate you guys in starting this, and please always feel free to reach out to Philadelphia. We're here to help you guys or answer any questions you may have. And, as far as the officers, if you want to reach out, because we've, tried different things, gone different ways many, many times. And if we can help you in any way, we're here to help. Thank you so much for having us today. We really appreciate it. And we're very grateful that you're starting a program.